I'd like to just begin by also acknowledging the traditional custodians of the lands, the Kulin Nation, and to pay my respects to elders past and present. My name's Catherine Luckin. As Ingrid mentioned, I'm the CEO of the Academy, and I'm absolutely delighted to be here. This is my first Life as a Clinician-Scientist event since 2019 in person. There was one last year I know in Melbourne. I was on maternity leave at the time, so yeah, I'm absolutely delighted to be in this room with all of you and to hear all of your excellent questions and conversations. Thanks also to Ingrid for all her work in pulling this together, and to our events manager, Claire. My pleasure is to introduce the first speaker of this session, which is Professor James Beeson. He is Deputy Director of the Burnet Institute, looking after and Head of Malaria Immunity and Vaccines. James is a medical researcher and public health physician and a fellow of the Academy as well, of course. And after completing a PhD in 2001 on malaria in pregnant women, including studies in Melbourne and Malawi, he completed postdoctoral research at the Kenya Medical Research Institute and the University of Melbourne. And he was a group leader at the Walter and Eliza Hall Institute before joining the Burnet in 2011. So as you can hear, you're going to hear quite a different perspective from James this morning. He's worked in the field of global health for over 20 years, with a focus on infectious diseases and maternal and child health. And it's my pleasure now to hand over to James.
Great, thanks a lot for that. Hopefully that audio is all right, but give me a wave if there's a problem. Thanks very much, Catherine, for that intro. And yeah, I probably don't need to recap my background then. I just was going to just give that as some perspective. I just would emphasise that, you know, my focus is really around global health, malaria, maternal and child health more broadly, and in resource-poor settings, rural and remote communities. And I think the theme of this talk is really about how do you achieve your impact from your research? Why is that important, and what does that mean? And I think looking back, I've taken a few risks with my career, but I just had that in mind, what I wanted to achieve. And you know, if it worked out, great. If it didn't work out, I'd go to plan B. So I think that's really my message here, is to sort of stay focused on your impact. So, you know, what is an impact then? So I've just got a few notes here. I mean, we're all clinicians of some sort. I don't know the makeup, but, you know, whether we're medically trained, nursing, you know, physiotherapy or whatever, we're all, you know, health professionals of some sort. And so, you know, this is what we're really trying to achieve, isn't it? Improving health and well-being and providing benefits to the community, wherever that community is, whether it's the wider Australian community, global community, specific communities in other countries. Breaking it down a bit more, then we think about having an impact from our research in different ways. So it can be advancements in knowledge, it can be informing clinical practice or clinical guidelines, providing evidence for public health policy, implementation of interventions, for example. Others might have impacts that relate more to industry around, you know, products, diagnostics, vaccines, new drugs, other tools, reagents, resources. And then, of course, don't forget training and capacity building. You know, for many of us, that can be the greatest impact, is training that next generation of researchers and advocates. So what I wanted to say is not where you publish and the impact factors of the journals. Yeah, sure, that can come into the mix a little bit when you're applying for grants, but don't think about that, don't obsess with that. Just focus on the impact of the work that you're trying to achieve. And I'll come back to that point. It's worth having a look on the NHMRC website, because they've got, if you just search for NHMRC research impact, you'll find it, the page. It gives a sort of breakdown, a brief, not a long, but it gives you a bit of information about what sort of benefits that people think of, the types of impact, how impact can be communicated, and some metrics about how impacts are assessed. And a lot of that's been sort of formed and created, you know, written from feedback from other researchers. So it is sort of meaningful. It doesn't capture everything. It's hard to get all of the wording right, but it's a useful starting point. And they outline these 4 types of impacts, sort of knowledge impacts, health, economic and social impacts. It's worth having a read of those. Just some examples of wording off NHMRC site or some of their grant scoring guidelines that give you a taste of what they mean by how impact might be assessed, which helps you think about, what sort of impacts your work might have and your career. So things like highly significant transformative changes or outcomes in scientific knowledge, practice, policy underpinning important human health issues. So this is the thing, the highly significant and transformative. Now that's what in a long term you want to be trying to achieve for impact. Paradigm changing development that's led to new knowledge in the field, recognised internationally, significant influence beyond your specific field of research, or the development of a new field entirely. So we're talking pretty high level impacts, and these really are thinking about these as sort of long-term goals. Can also be improved health or health systems, services, policies, programs. It's not all about discovery, and I'll come to that as well. You can achieve impacts through a whole range of different angles and stages in the whole health pathway. And also think about the type of work you do. There are a couple of points about the way you go about your work. Comprehensively integrating complementary information, data, techniques, tools, perspectives and concepts. And having a scientific framework, design, methods, analyses that are highly developed, highly integrated, highly appropriate. So that's just give you some flavour of the sort of language that just helps you think about how should you be aiming with your work? What's the sort of ambition of your work? This is what you'll often see in documents, this sort of discovery through to impact pathway. And I'm just going to say I'm going to reject that for a moment and say because it's not linear and it's not unidirectional. And it gives a sort of wrong impression, I think. So I'm going to go for this sort of model where in fact it's a discovery, translation, impact cycle. So because discovery can start here and go through translation, through to clinical population, etc. But it can also start here. People make discoveries in their clinical studies from case series, for example, or small case control studies. Make a discovery and then progress through this way. You have feedback through, these insights at clinical and population studies, especially for this audience as health professionals. You make insights here that feed back into that discovery and translation pathway. The other point I want to make is that all the stages are important, and where you contribute, you could contribute at different stages along this pathway. And it's really about the distance from the impact. It's not about the importance. So discovery is important, making new discoveries. So is translation, clinical, population. Some people are right at this end around policy, implementation, commercialisation to achieve the impacts. And undoubtedly, as you'll find through your career, even if you make an impact, it then just sparks more ideas and questions that you want to pursue for future improvement, so at whatever level. So in terms of conducting your research, I think the planning and setting very clear goals is absolutely crucial, and just thinking about those impacts. So clearly define the clinical or public health need and the key knowledge gaps, and having a really strong understanding of the current state of knowledge. And talking to my colleagues about just getting their feedback about how they go about this, they all really highlighted this. Absolutely define what it is you're trying to achieve. That's the fundamental starting point. Whereas I think coming out of, especially out of the university system, it's often the starting point is, the question. What's the question? And sometimes a bit disconnected from what the ultimate impact that you want to achieve. So there is a role, of course, for that just completely blue sky discovery research. But I think in the health space, it's really important to think about what is the public health need or clinical need. Define that. What do you want to achieve? What's the knowledge gap? And anticipate your potential benefits. What will the benefits be? Who will benefit? It can often be really helpful as a starting point to align your overall strategy with national or international guidelines. So for me, we because we work in global health, it's aligning our goals with WHO or other major bodies internationally. But equally, people that I work with will be looking very much at the Australian strategies that are specific to our populations, or it might be specific to Aboriginal and Torres Strait Islander communities. So these are really quite useful ways of focusing your research as a starting point. Then you really got to, once you've established what it is you want to achieve and who will benefit and what are the key gaps, develop a strong study design. I've just put this point, try to do what is needed, not what is convenient. So it can be hard. You want to go, okay, I can see where I want to get, this is where I am now. I need all of these different resources, different expertise, and 2/3 of it I don't have. And so it's you can go, I'll take the easy route and just do what I can do. Sometimes that might be the only option, but it rarely is. Try to find those missing parts of the puzzle through collaborations, through getting funding, through talking to colleagues, and you'll find that often you can move beyond what's convenient and what you think is immediately doable to what really needs to be done to get the best outcome. Just keep encouraging innovation in yourself and in your team, the people that you work with, because that's at the heart of making these advances. And as I pointed earlier with that pathway, innovation can come at all sorts of different levels. It's not just thinking about discovery. Innovation comes with the implementation side of things as well, or in policy. So really think about it at all levels. You need to obtain and develop the resources you need as you go, of course. And I'd just say collaborate. Really increases the scope of what you can do. It's rewarding as well, personally, working with other groups and other researchers, health professionals. It's crucial for health gains to collaborate and build a supportive team over time, and they'll help you over time. And that was probably one of the best pieces of advice I got very early on before I did a PhD, was to collaborate. One of my mentors said, don't lock yourself away and just do your own thing. Get out there, collaborate. Another mentor of mine told me that he was always very open about what he was doing. He didn't worry about disclosing unpublished data, and it always benefited him, except possibly one case that didn't work too well. But he was very open and collaborative. Then you've got to maintain momentum, track your progress. Just keep those long-term goals clear is what's important there, and stay connected with the problem. And I think that's a real advantage for you as clinicians, healthcare professionals, is you're seeing the problem. You're connected with the community. For us in working on global health, we work with our communities who are affected by the diseases we study, and that gives us that connection and reminder of what we're doing and helps keep us focused on what our longer term goals are. So I think that's a real advantage for you as healthcare professionals. Try to maintain the highest quality that you can. You've got to consider new findings as they emerge. That will influence. Things will change, things will develop. You'll rethink your strategy. Obviously, if you set out on doing an RCT, you're locked in to your protocol, to complete that RCT, but it doesn't mean that you can't bring in other expertise for the end result and to build on in exploratory studies. I think this is a balance. Be open to new ideas and opportunities. And reflecting on colleagues I've seen talk about their careers, often a highlight is, people being open to opportunities and new ideas, as well as having the long-term vision. But you've got to balance it and not getting too diverse, so that you don't complete, your sort of core focus. Keeping collaborators engaged, they'll help you, you help them, to develop that supportive network. So then I think, in terms of what do we mean, how do we get to the point of high impact work? And I'd say an important part of that is the level of evidence and the relevance of your findings. So hopefully some of you would be familiar with these levels of evidence. You've got low levels of evidence, which might be case studies and case series, and you've got high levels of evidence, like large randomised controlled trials, meta-analyses of multiple studies. That's the sort of higher level of evidence. So you've got to think about that. That's where you're going to make your impact. You make your impact if the level of evidence is higher. And you may not do that in one study. It might take several studies over a period of time, or working in multi-centre studies with collaborators nationally or globally. Then think also about the layers of evidence. So that's what you'll see in terms of work that really has an impact. It's also the layers of evidence. So, and it's different for different topics, and we've got a diverse audience. So, you think about complementary experimental approaches if you're more at that earlier, discovery phase of work. Think about the depth of the data you have and the evidence. On the one hand, you may think of a clinical study. It's in a simple example is just thinking about all of those potential confounding factors, all of those comorbidities that could be influencing your outcome, for example. In clinical, the other one is that people might combine clinical studies and model systems, like, whether it's an animal model, an in vitro model, or in silico models. And then the other would be think about the scale of your work. How representative is your study of the population, and how generalisable is it across different populations? So ultimately you may need to do studies in different populations. So these are the sort of factors that all feed into achieving impact. And you may do a relatively small study in a defined population and you find an outcome, and then you expand that to include other populations or other age groups or other subgroups to understand that generalisability and applicability of your findings. I also like to encourage people to read the Bradford Hill criteria of causation, which gets you thinking about the different pieces of evidence to support causation. And then ultimately there's no proof. It's the amount of evidence that you have. And there's some really good examples, and I think one example is smoking. We haven't done an RCT of, we've got one group who smoke, one group who don't smoke. So there are some constraints to what's achievable, but we accepted that smoking was a major cause of heart disease and cancer before all of those criteria were met. So it's worth reading and applying that to your thinking. This point is important, that building impact over time. So if you're entering a research career or you're already started a research career, think about building impact over time. And over the course of your career, it can come by step-by-step advances, a series of quality papers that one builds on the other, or, you build the foundations of the work that you're going to then step on to make those greater advances. And other times, of course, you'll see, big study outcomes or big papers that are major clinical trials so you might have these single major papers, for example. But your career will generally have a mixture of both. It doesn't have to all be the really high impact papers, as people like to talk about, but you do want to have that consistent quality. So build impact over time and over your career. So with all of the projects, build them into that bigger objective, and you'll work with your collaborators on those. Build momentum over time. It does take time. You start in your career as often just you, maybe a few colleagues, and you build that over time. And you need to grow the research skills and expertise of you and your team. Develop collaborators and partners over time. And another one that I'd really encourage you to think about is linking with community groups or industry partners, government, whatever's relevant to your work. But for example, in HIV research, there's a lot of engagement with people living with HIV, with that community, with that group as advocates, and I think that was really powerful for getting advances in the field. I'd also mention that, people contribute and achieve impact through different ways. You don't necessarily have to be a group leader and lead a whole program. Some are extremely effective clinical collaborators. They, over their career, run clinical trial sites, recruit patients or participants into studies, or contribute specific expertise over time, and you can be an extremely effective collaborator and have a substantial impact that way. You don't necessarily have to go down the path of an independent group leader getting, all your own grants and supporting a team. That's one path, but there are different paths to achieving impact. And just, always be thinking about training and supporting the next generation of leaders. And one of the challenges, I think, is that, sometimes at a relatively junior stage, you'll then find that there are people below you that you're mentoring and having to support their career when you feel like your career is only really just starting. But that's just part of the process. So you have to sort of manage that. And I just say, that's a really important part of what you do. Of course, securing sustained funding is important. You've got to look at funding from diverse sources. Generally, though, I'd say projects with clearly defined goals and impacts that address an important need usually get funded. You might have to have several goes, but if you've got a really strong goal, you'll generally get funded. And manage funding gaps. And just coming back to that, don't get obsessed with papers, because if I talk to a philanthropic organisation about funding a project, they're not interested in papers. They want to know what are you going to achieve and who is going to benefit. And even the big funding agencies, I've been on NIH grant review panels, various NH and MRC panels, reviewed grants for Wellcome Trust and MRC and other agencies. And it's not about papers. It is to a degree, of course, but it's the whole picture, and it's really important. What is the work trying to achieve, and what's the quality of that work? So that's why I'd say, really just keep that focus is really important. I wanted to acknowledge that, our funding model has many problems, and a lot more needs to be done to fund and support career pathways, but there's a lot of discussions going on. The second one I wanted to point out is that gender equity has improved substantially, but we've still got a long way to go. But many organisations like my own, take this very seriously, and I was just on a call during the week with NH and MRC around in a discussion around this point. So it is changing, and the capacity, the options of having a family, having a career, are getting a bit easier and are being, better supported. But I just want to acknowledge that point. Let's just move to then, achieving the impact. You've done your thinking. You're working on your research. You've got some outcomes. You've thought about, who's going to what's the change that's going to be created by your work, and who's going to benefit. What are the routes to achieving impact? Because that's the starting point. How do you disseminate that information? How do you have that research knowledge enable that to have an impact? So that's where you really get help from your organisation. It's their responsibility to help you with this, and many of them will have engaged in that quite well. You can work with collaborators, partners, especially look at community organisations and advocacy groups, because they will really often pick up these things and help you. Then communicating and publishing your findings. I just sort of point out a balance. You've got to balance the timeliness and the impact. Many times you'll be encouraged to really look towards that big impact paper, but you also have to balance being timely with the knowledge. Especially with health research, you might have knowledge that's really important clinically or for informing public health policy that you can't really hang on to for years while you build up your story. You've got a sort of obligation to get that out there, and so you have to find that balance. And I just say, publish quality, not quantity. All of the grant applications are looking at the quality of your outputs, not the quantity. So don't feel like you have to be pumping out papers all the time. You just focus on that quality. And a lot of us find it helpful to set a minimum benchmark, to say, I'm only going to publish work of a certain quality. And over time, then you'll build a reputation for quality work. And I think all of the speakers following me, if you look at their career, you'll see they just consistently produce work of quality. And think about these. Avoid that sort of obsession about impact factors. I know that does come through a lot, and you're sort of made to think that this is important. As I said, it's important to a degree where you publish, because the journals will help you reach an audience, and journals with a high profile mean you'll reach a greater audience. But sometimes that's not necessarily the impact that you're trying to achieve. So you just got to try to find that balance. And I would say the lesson that I've found from my work and all my colleagues that I work with, if you're just doing that high quality work, it will publish well and you'll get recognition for that work. So there's sort of a case of, try to do something important and your career will take care of itself. Of course, there are these other forums that I won't necessarily talk about that, but we sort of remain a little unconvinced about how helpful social media is, and some of my colleagues have abandoned it and refused to participate now. It's beneficial to a degree, so you've got to use all the different strategies. Think about the audience that you want to reach. And I just want to add this point on several editorial boards for journals. So what are they looking for? What do they think of as high impact? Well, that's really, they've got a very high bar for the quality of your studies, the evidence supporting your conclusions. Novelty and innovation is important at whatever level, as I said. It could be clinical, could be implementation, it could be discovery science. The implications of the findings have to be clear. So what's going to be that health benefit? Or, if you're not directly having a health benefit, what could be the benefit? The extent of the impact, who will benefit and how. And timeliness is a factor. If you're publishing on COVID right now, you're going to get picked up by the higher impact, higher profile journals. If you're working on schistosomiasis, you're going to find it harder. That's the reality that we work in. But just focus on what your long-term outcomes are. But sometimes timeliness is important, and you need to think of that. They're often looking for state-of-the-art approaches, those things that really push the field forward. And it doesn't have to be high-tech, but it sort of does need to be the leading edge of current thinking. And then, either they're looking for direct clinical public health impacts or advancing translation or paradigm change. They're looking for mechanisms rather than descriptions for the sort of discovery science. I'll show you this example too from my colleagues who did a large study in Myanmar, rural and remote communities, geographically isolated, and they did an implementation trial, not an RCT, so an intervention for malaria that's being rolled out to everyone, and they did it in a randomised sort of stepped cluster model so that they could quantify and work out what worked and how well. This is large scale, so 32,000 subjects, 45,000 malaria tests, and showed that the intervention reduced malaria by 75%. All right, thanks. Happy to take any questions or comments.
Thanks for that, James. Have we got any questions in the room at this stage? Not quite yet. Okay, in that case, I will take some from our online audience. A reminder, there's a text box. You can put your questions in if you're joining online, so please do that. One here about lab-based research, James, which I wonder if you can help with. I see many junior doctors get to help with clinical research, but not lab-based research. They get support for that, is the question. How do those of us interested in lab research gain this kind of experience when all the support's more focused on the clinical side? Is the experience of this person?
Yeah, that's right. Naturally, as a clinician, you get more exposure to clinical research and maybe implementation research. I think it's a case of reaching out to colleagues, asking them for advice, getting them to introduce you to people they know that have that interest in perhaps bring lab-based research into clinical health problems. There are plenty of opportunities out there. There are lots of medical research institutes like mine, or WeHi, or QIMR, or wherever it is, interstate. And there are, of course, lots of university departments that do laboratory-based research, often linked to a clinical problem. So I think I'd say a good starting point is speaking to colleagues. You'll find a lot of people in the hospital system as well have those links of researchers in lab-based research.
Great, thanks, James. Any questions in the room? Yeah, just over there. Oh, and there's one. Oh, okay, we'll start over there.
Thank you so much for talking about gender equity, and I know that it's been a topic of discussion during the NHMRC consultation process recently, especially with the trends in the scissoring effect from early to late careers. However, something that I've found missing in the discourse is that intersectional piece where experiences of gender inequity also can intersect with class, race, sexuality. So is there much data around that, or steps and initiatives to combat that? Just speaking as someone probably with lived experience of a multiplicity of those factors that can also be a real hindrance to pursuing a career like yours.
Yeah, I think that's a really important point. What I would say, I guess, something that we could spend the whole day on because it's such an important one. What I would say is briefly is that there's a lot of work being done and a lot more recognition of the importance of this by institutions like mine and others and university departments. Your experiences are going to be different, and unfortunately some of you are going to have experiences with departments or whatever organisations that perhaps aren't doing as well as they should be. But there's a lot is being done in this space in terms of funding, in supporting careers, professional advancement. So I think we've come a long way in the last 5 years for sure. We've still got a long way to go. I think, you can talk to your colleagues if you feel people should feel that they can approach leaders in their department or organisation if they feel that the issues are not being appropriately managed. A lot of organisations have officers or leaders appointed in the gender equity, diversity, inclusion space. So I think there are a range of sort of supports and links that people can use. It is a challenge though, especially for some, I would say for women with children is still a big challenge, or other people with significant carer responsibilities, just trying to balance the demands of a research career, a clinical career, and family. So, that's the space that really, there's a lot of work being done and needs to improve.
Great, thanks James. And I might also ask Helena that question because I know she's given a lot of thought to that and she's nodding, so we will certainly also ask for her insights on that in the next talk. Can I ask you another question, James? We've had quite a few questions online about timing of PhD, and I'm sure it's a burning one for people in the room as well. Could you just maybe talk about the timing of yours, pros and cons of the timing around doing a PhD? And another question we had online was some of the pros and cons of doing either a PhD overseas or some clinical training overseas, because obviously you've had a bit of experience internationally as well.
Yeah, I think doing a PhD, timing, look, I think you can really do it any time. I'd say though, doing it earlier in your career after graduating is better than later. It gets harder to do it, but I've got a colleague who did it very late in his career. Then there's the question of, do you do it before your specialty training or after your specialty training, or how soon, or do them together? And people do it all different ways. I don't think there's necessarily a particular way you should do it. Probably do it the way that works for you. Perhaps, Helena might want to comment on this too. Perhaps doing it towards the end of your specialty training, where you can sometimes get some of that period accredited, and you're almost finished. It's just a bit easier to manage that. And then you've got your specialty training completed, you've got your PhD, and then it really enables you to then build momentum. But I think you've got to find the pathway that's right for you as well, and it's heavily influenced by personal factors, whether you've got a family, you might have a mortgage, for example, or other financial or carer responsibilities.
And how about the pros and cons of heading overseas?
Yeah. I think, absolutely. I think it is really important. I was going to talk about that, but it was a bit short of time. But I wouldn't necessarily... you could do some of your PhD overseas, but I think definitely either spending some time overseas during your PhD or post-PhD is really important, because taking you away from your organisation, does open your eyes to the way different organisations run. You'll learn things, positive and negative, from working in another organisation. It also helps build contacts and networks for you. And in some cases, especially if you're coming from a relatively small group, you might find that you go to some of these large European or North American centres and find, that it really opens your eyes to what can be done, and that the ambition of the work that you do to achieve your impact. So I think there are lots of benefits. You could do it either way, yeah.
Great, thanks James, that's been really informative. Please join me in thanking James for that talk.
Okay, thanks.